Good afternoon, good morning, everyone, and thank you for joining us for the webinar, Responding to Familiar Faces in Crisis Part 2, Engagement Challenges and Strategies. It's now 2 p.m. Eastern Time. We'll get started in a few minutes to allow for some additional sign-ins past the hour. Good afternoon or good morning, everyone, and thank you for joining us for the webinar, Responding to Familiar Faces in Crisis Part 2, Engagement Challenges and Strategies. My name is Mark Stovall, and I'm a project manager at the Council of State Governments Justice Center, and I'll be moderating today's webinar. To give you an overview of the webinar today, we'll start with some introductions, including a description of the Stepping Up Initiative and the MacArthur Foundation's Safety and Justice Challenge. Then we'll hear from our 3 sites, Bernalillo County, New Mexico, Fulton County, Georgia, and Polk County, Iowa, about the engagement challenges they've encountered in their familiar faces and crisis work, and how they're working to address those challenges. And at the end of the webinar, we'll have time for questions and answers from the audience. We encourage you to enter questions you have into the Q&A panel on the right-hand side of your screen. We're excited to have a few panelists from the county teams with us today on the webinar. From Bernalillo County, we have Pamela Acosta, Special Projects Coordinator at the Resource Reentry Center, Bernalillo County Department of Behavioral Health Services, and Joey Diaz, Criminal Justice Systems Data Analyst, Bernalillo County Manager's Office. Nicholas Hagini, Court Policy Analyst, Superior Court of Fulton County in Georgia, Annie Utes, Program Planner, Polk County Health Services in Iowa. And I'm joined by my colleague, Risa Hanneberg, Deputy Division Director in the Behavioral Health Division at the CSG Justice Center. Thank you all for joining us for the webinar today. Before we get started, just a few housekeeping items to note. We're recording this webinar and it will be available for viewing within the next 2 weeks. And at any time during the webinar, you can chat a question to us by using the QA function on your screen. We'll try to respond to the technical questions as we go, but we'll hold the content-related questions till the end for the Q&A portion of the webinar. And now we'll turn things over to Risa Hanneberg, who will talk a bit more about the Safety and Justice Challenge, the Council of State Governments Justice Center, and the Stepping Up Initiative.
Hello, everyone. Just making sure my mic is working for all. Good. I see heads shaking. Hi, you all. It's so good to be back with you, and also with our 3 sites that we've been following their progress as they are working with their respective familiar faces population. As Mark said, with Polk County, Bernalillo, and Fulton County, all 3 of these sites are participating in the Stepping Up initiative, and in fact, all 3 sites are Stepping Up Innovator sites. And also they are participating in the MacArthur Foundation Safety and Justice Challenge. The Safety and Justice Challenge goal is around reducing the number of people incarcerated in our jails across the country, as well as increasing equity. The Stepping Up initiative, as many of you are probably aware, is the national initiative to reduce the number of people with serious mental illness and co-occurring disorders in jails and across the justice system. So as you can see, a lot of crossover there between the 2 initiatives, all with the same goal in lowering the number of people who are in our jails. Next slide. So just a little bit of background about the Council of State Governments Justice Center. We are a non-for-profit organization. We work with all 3 branches of government, providing technical assistance and policy and research support. Our main goal, if you will, would be to ensure safe and healthy communities across the country. I know many of you tuning in today maybe have been recipients of technical assistance through the Justice Center and or certainly hopefully have been participating through Stepping Up and the many resources and activities that we promote through that initiative. Next slide. And just a little bit more about Stepping Up. We just want to recognize that the initiative has now been around since 2015. We work closely with the partners from NACO, the National Association of Counties, as well as the American Psychiatric Association Foundation. We are now at 449 counties that have passed resolutions to participate in Stepping Up. If you're listening in today and you have not yet passed a resolution, just want you to know we just had one yesterday. It's not too late to start joining and participating officially. And we would just really love to make that 500 mark here coming soon. So want to say that we have at this time 34 sites across the country that are innovator sites. So, and again, our 3 participating today have all been named as sites who are able to accurately access and track their data and follow the people and the populations in their system with serious mental illness. Next slide. So just a little bit more context about this webinar and the other content related to this project. This webinar is one in a 3-part series focused on serving people who are among the familiar faces population, or people who frequently cycle in and out of jails, emergency departments, and homeless shelters, and serving people who experience crises. We hosted the first webinar in this series on May 13th of this year, and you'll see a link soon if you want to access that. And then we held follow-up office hours with our panelists for anybody who just wanted to call back in afterwards, have some informal discussion, ask questions, and so forth. We plan to host another follow-up session. Most likely that will be in early 2022. We are also writing 3 snapshots to give a point-in-time look at how each site is working with its familiar faces population. And we have 2 of those that have been released so far. Again, we'll provide those links. I will just note that one of them is really pretty hot off the press, so happy to have that out and about and circulating. We'll distribute the 3rd and final snapshot in the spring of 22, recognizing that this work is never really done, but rather giving information and sharing strategies about what has worked so far and the site's plans for moving forward with their projects. And you should be seeing links to all of these resources, as I said in the chat box. Next slide. And also, I of course want to give a shout out to our Taking the Call event that we held end of October. This was the event that was on the topic of crisis response, particularly for sites across the country that are now looking to develop community responder programs, or that the response that is not involving a law enforcement response. So this event, we gathered all sorts of resources. We have put them together in a convenient website location there. And again, really encourage you to access that information. Okay, and I think at this point in time, we are going to turn it over to our presenters from Bernalillo County, Pam Acosta and Joey Diaz.
Thank you, Risa. We appreciate the invitation to present and the opportunity to share what we're doing here in Bernalillo County. My name is Pam Acosta. I'm the Special Projects Coordinator. A little background on me. I have 26 years experience in criminal justice and mental health, and I've been working with the county for the past 9 years. I currently manage the Resource Reentry Center, which is a soft landing spot for those who are exiting out of our local jail, the Metropolitan Detention Center, and I oversee the transition planning program within the jail as well. All right. So today I wanted to talk to you about a few things. If you can go ahead and go to the next slide, please. I wanted to talk about some unique challenges that we're experiencing here in Bernalillo County, one tied to rapid releasers, housing, client engagement, and provider silos and data sharing. Next slide, please. All right, what do I mean by rapid releasers? Those are individuals who are released in fewer than 48 to 72 hours of being booked in. The challenge for us is that we're not able to connect clients with services as quickly as, or we don't have enough time to connect clients with services that we would like. There's a few things that changed in Bernalillo County over the past 6 years that really improved release times for Bernalillo County. In 2015, the New Mexico Case Management Order was passed, where Bernalillo County Criminal Justice Review Commission was tasked with reviewing the criminal justice system, including the judicial process and the overpopulation at our local jail, the Metropolitan Detention Center. The commission concluded that the system must be revised in ways to reduce the population and to impose definite and enforceable time limits on criminal cases as a step towards speedy resolutions of criminal cases. Part 2 of that is in 2016, we had a bail reform where New Mexico voters approved a constitutional amendment which prevents low-level defendants from being held simply because they lacked resources to post a bond. The court began to look at levels of dangerousness and or flight risk. Having said that, clients are getting out a lot faster now. And so some of the impacts that we see with those rapid releases is all of our transition planning begins at booking. When they're released faster, it limits our ability to connect with them, form a rapport, and to complete the necessary documentation, such as a reentry needs assessment and a transition plan. Another unforeseen challenge that came about with these changes is when people were in custody a little bit longer, they could get stabilized on medication. They had time to be assessed, evaluated, their blood work completed. And the rapid releases, they don't even have an opportunity to get started on meds or even get stabilized on meds. And the same goes for detox. Many clients were able to detox while in custody, rapid release. Sometimes they arrive at the Resource Reentry Center and they're still in a stage of detox. And then, of course, release times, rapid releasers, and especially for our familiar faces, because they're required to be released so quickly, some of them are released in the middle of the night. So there's not a lot of access to resources or community services that are open at that time, and it's difficult to connect them to services. So a few of the solutions that we've come up with at Bernalillo County is of course, we have the Resource Reentry Center, which I manage, and again, it operates 24/7. It's a soft landing spot for those that are exiting from the jail. We use motivational interviewing to engage the clients while they're at our center to get them to stay longer, not to leave right away. We convince them to spend the night. They are able to spend the night and wait until morning so that we can connect them with businesses that are open. We also have our business card available at the jail and at the RRC so that clients can call us. So if they are a rapid releaser and maybe they come through the Resource Reentry Center really quickly, they have our phone number and they can call and get over the phone case management. Next slide, please. All right. The second issue that we're having here in New Mexico is housing. So obviously we have a lot of wait lists. Some of them are extending up to 2 years, some of our wait lists. And and I think this is a problem that many are experiencing across the nation. There's just not enough permanent housing. Another issue that we have is, of course, if there's not housing, we want to send people to shelters, make sure that they have a safe place to go and a safe place to stay. But there's a lot of shelter misconceptions about rules, about safety, about the requirements when they stay there. So some of the solutions that we have implemented here in Bernalillo County is this. We are offering 7-night motel vouchers. This is a partnership with the city of Albuquerque and one of our local agencies, First Nations. And so when they get a motel voucher, they're also connected with long-term case management. We do have a partnership with the city of Albuquerque for their shelter that they run. And this partnership allows them to extend their pickup hours specifically for the Resource Reentry Center. So rather than clients having to run and meet the vans or the transport vans at the pickup sites, and sometimes if they miss that, they're left out on the streets, they've extended those hours specifically for us. And again, we have case managers on site who can address some of those misconceptions about the shelters. And we also offer to secure beds with them with other local shelters that provide longer term stay, whether it be a 30-day stay, a 7-day stay, or even educating them about the city's shelter. And then we have something new that will be opening up in January of 22. And it's with a partner, Hope Works. It's a 42 single site permanent housing solution. It's the first in New Mexico, and it provides permanent housing to chronically homeless individuals alongside supportive services designed to help them get stable and housed. Case managers will be on site. Next slide, please. All right. The third obstacle that we encounter here in Bernalillo County is client engagement. And we have client engagement issues both pre-release and post-release. Pre-release, a lot of individuals, we have to look at whether it's a circumstance of why they're asking for help or whether it's really change readiness. Some clients believe that if they try and work with a transition planner and develop a plan that it'll help them with the local judge, pre-adjudication, it looks good, but their motivation isn't there. So we task our transition planners within the jail to go out and meet with folks and sit down and explain the benefits and get them engaged and get buy-in into their transition plans. And we also determine the level of change readiness. Again, we offer our business card so that if their engagement level is low, they can call us afterwards. A lot of times people will leave the Resource Reentry Center, call us a few days later, wishing they would have stopped to meet with a case manager. So at least they have their business card and they can call us back. I'm going to hold off on the high frequent utilizer until I get past the post-release concerns, because I want to elaborate a little bit on that before I pass it on to my colleague Joey. Post-release, one of the challenges that we have is non-working numbers, or being able to connect with clients after they've released from the jail. We do conduct outreach phone calls to clients who we've engaged with, but sometimes, and many times actually, the phone numbers are disconnected by the time we reach them. Maybe it's invalid contact information. So what we try and do ahead of release is we request both a primary and a secondary number, even if it's a message number. And if they're homeless, we try and obtain cross streets of where they normally stay. And then we connect with homeless outreach programs in the community and let them know we have some of our clients and this is where they typically stay. Can you touch base with them? And then we also connect our clients with local agencies that offer free mail and messaging services so that they can get their mail, including, when they get notifications from the Human Services Department regarding their SNAP benefits or Medicaid benefits. It's very beneficial. All right, and before I move on to the next slide, I wanted to talk a little bit about the high frequent utilizer group. So that's one of the solutions, and we can actually go on to the next slide because it ties into it. All right, this is related to provider silos and information sharing. So some of the challenge that we have is there's many agencies that are working with individuals, and a lot of times we're working with the same individual unaware of one another. There's a lack of communication, there's a duplication of services. I have heard in the past that there are some agencies where, there might be 4 or 5 agencies working with the same individual and applying at the same agencies. And so we are trying to address that by we have, through our Criminal Justice Coordinating Council, we have a high frequency utilizer group. This group is really focusing on how do we share data, how do we communicate data, because one of the challenges is that some folks are, or some agencies have limitations on what they can share. And then there's some hesitations, you know, and because nobody wants to go into litigation. And so we're trying to provide some solutions. So this group, it includes folks represented from the courts, public defender's office, managed care organizations. We have law enforcement there, both our sheriff's department and our local police department. We have leadership from the city and leadership from the county on the behavioral health side, as well as the jail. One of the things that we're working on right now is a memorandum of understanding. We want to design a memorandum of, or we're in the process of actually finalizing our memorandum of understanding that dictates how we will interact, how we share information, and what this information can be used. And really, it's just to coordinate care on behalf of our familiar faces. And one of the things that we're really focused on right now is we have the population, and we're looking at what most people will refer to as difficult to engage. We have coined a different name, developed a definition, and we're now calling them essential to engage. We recognize that there are some clients who are either not stable enough to recognize the help that they need. Maybe they're too involved in substance abuse. Whatever the reason may be, they are our most challenging, and one of our primary focuses is our essential to engage. And hopefully through the memorandum of understanding, and we also use a universal release of information, which allows all of these agencies who are on the memorandum of understanding to be listed on this universal release of information, which not only gives the county permission to talk to each of these agencies, but these agencies to also talk to one another. Credit for that goes to San Diego County. They had one of the first universal releases of information, and we've tweaked it, and it's been approved by our legal counsel. The last solution that we are working on is a system by which we can, and I'm not going to get too in the weeds with that because I'm going to leave that for my colleague Joey to talk on, but we are developing a system with New Mexico Tech. It's a HIPAA compliant data tracking system. And just briefly to kind of give you an idea of how this would be beneficial. Say you have a law enforcement officer who encounters somebody, a familiar face out in the community. They have three options: take them to jail, take them to the hospital, or let them go. We're trying to develop a system that will allow the law enforcement agency to research the system, find out who their primary agency is that they're assigned to, their case management agency, and then from there connect them to services rather than taking them to jail or to the hospital, or in fact letting them go. So having said that, I'm presenting with me is Joey Diaz. He's our criminal justice data analyst, and he can elaborate a lot more on the system that we're building with New Mexico Tech. So thank you for your time, and Joey, take over, please.
Thank you, Pam. Appreciate it. You can go ahead and go to the next slide, please. Just for a quick background, my name is Joey Diaz, and like Pam said, I'm the criminal justice data analyst in Bernalillo County. And I work mainly with criminal justice data and approaching that data to integrate it in an operational way while also curating high-level analytics for our decision makers. So just a little bit of background on where we're at with this project and kind of what it is. Our big idea for this project with this is sort of the cornerstone or the foundation is to be able to improve the exchange of information around criminal justice involved individuals in Bernalillo County, with the ultimate goal being to develop a cloud-based data consolidation engine and a web application that can be used across agencies. So we picked this as a point of entry into identifying a business process that was not only very critical, that could provide a high impact to the business process around the individuals identified on the high frequency utilizer list, and also being something that was sort of low-hanging fruit that we identified. So we partnered with University of New Mexico, New Mexico Tech, and their ICASA office as a development group to be able to do this. the ICASA office is involved in a lot of statewide projects as far as data integration is concerned. So we partnered with them because they have a large base of institutional knowledge on how to navigate these kinds of things. So essentially what this application boils down to is being able to ingest the high frequency utilizer list that is curated at the Department of Behavioral Health Services in Bernalillo County by one of their data analysts, implementing some middleware from ICASA to be able to push the data back to the RRC, flag individuals in their database that are identified as high frequency utilizers, while also matching some information and pulling down their data in a tabular form from their universal ROI, and then pushing it up to a cloud-based server that's provided by our state, which is known as the New Mexico Data Exchange. So in a nutshell, it's a very simple kind of application, and we're creating a data set that can be operationalized across agencies so that these individuals can be identified at lower intercepts and provided resources that can divert them from the cycle of re-entry into our jail system. I think that's about it for what I have. Happy to answer any questions if anybody has them on a more technical level. I don't want to jump too much into the weeds. I guess I would be remiss to say that some of our challenges here have largely been around policy and constructing a usable framework and architecture to where agencies that do want to participate can feel safe and comfortable with the policy that we've constructed for around privacy law and also cybersecurity, while spelling out liability and risk for publishing data and operationalizing data across agencies. So that's been one of our bigger challenges, and we are attempting to form a larger governance or policy governance subcommittee to be able to work together across agency lines to define that in a more rigorous way so that agencies can feel safe and comfortable sharing their data throughout the entire criminal justice ecosystem. Thank you very much. I appreciate your time.
Thank you so much, Pam and Joey. And now we'll turn things over to Nick from Fulton County.
Yes, thank you, Mark. Hi, everybody. My name is Nick Hagini. I'm a policy analyst and statistician working for the Superior Court of Fulton County. Just for some context about Fulton County, Georgia, this is Atlanta. So a very high population area, a very densely populated area, a very urban county. Just to give you an idea about the community that we work in and that we're coming from. Next slide. So when we were putting together this presentation and thinking about the challenges associated with engaging with our familiar faces who are in crisis and the high need population as a whole in Atlanta, we wanted to bucket those challenges into two areas. And initially we were thinking the pre-arrest and post-arrest spheres, but we kind of thought that pre-arrest was an unfair way of framing this because we don't want to treat arrest and criminal justice involvement as an inevitability, even though historically, this has really been the case for this cohort of individuals that we're focused on. And one of the big goals and reasons for this project is to stop the flow of people with extremely high needs into the jails. So we thought the better way of framing this was as our community challenges and our challenges that occur once our individuals do enter the criminal justice system. And so, one of our biggest challenges is that when one of our familiar faces, when one of our high need individuals is in crisis, law enforcement is almost always going to be the primary engagement entity. And law enforcement does not currently have many options as to what they can do for somebody in crisis. They can take them to jail, which is by and large what happens, or they can occasionally transport them to Grady Hospital, which is our largest safety net hospital. But Grady is not a diversion center. It's not a law enforcement drop-off center. They have limited beds. They have limited staff. Grady is already, at max capacity pretty much all the time. So this is, not really a solution. And the default response becomes that anyone in crisis gets taken to the county jail. We do have a lead program here, but it is very underutilized. It has limited hours. It's not a 24/7 program. There's not a law enforcement drop-off center attached to it. And even in cases where an individual would be a good candidate to be diverted from arrest, law enforcement typically does not do so. There's limited buy-in from our police departments. And, this is something that we're working on and engaging with. I've done lots of data analysis highlighting potential diversions or, arrests that could have been diverted or that we would like to see diverted. But, this is an ongoing relationship building exercise. And we have had some very exciting news about a diversion center that I'll talk about in just a little bit. So we're really hoping that this is something that is going to vastly improve over the next year, the next couple of years. But that has been a very big challenge for us. As far as getting law enforcement buy-in, one of the things that we have focused on is trying to get law enforcement to flag our familiar faces list within their data management system. And so we've had a lot of success amongst our behavioral health and non-law enforcement agencies as far as flagging our people in their systems, and it's yielded good results. But that's still a conversation that is ongoing with our law enforcement agencies. And that sort of relates to the information sharing problem that we experience throughout the county and throughout the city. Our agencies do not traditionally work in conjunction with one another. Very little information has been shared prior to us engaging with this work. So there's a lot of redundancies. There's a lot of people who slip through the cracks because either somebody doesn't know another agency is working with an individual, or they assume that an agency is working with an individual when they are not. So bridging those kind of information and data sharing gaps is a major goal of all of our work. And the preliminary information sharing that we have begun to engage in, and that I will talk a little bit more about, has yielded much better results compared to the traditional way in which high need individuals were treated within the criminal justice system. Then we have a lot of gaps in services. Georgia ranks like dead last in the country in mental health care accessibility. We don't have enough programs and services, and the ones that we do have are, almost always just at full capacity. Like for example, Grady has ACT teams, assertive community treatment teams. And the ACT criteria throughout the state is the same. But because Fulton County and Atlanta is such a densely populated area, they don't have the same capacity that you would find in a more rural or less populated area of Georgia. So the criteria to get into these programs becomes a lot higher compared to, anywhere else in the state. So it's, kind of a battle sometimes to get people enrolled in the services that we know would greatly benefit them. And so that covers our main challenges in the community. In the post-arrest arena, one of our big issues is that the city and county court systems are separate. We don't operate under a unified court system. So especially with this familiar faces population who just has a ton of arrests and a lot of cases, there's a lot of jurisdictional overlap and problems that arise because of that, because our individuals will have multiple open cases across the city and county, which then just makes it more difficult to resolve like all of them, leads to people spending longer in jail and taking much longer to get their cases resolved. And then, just like probably every jurisdiction in the country, we have some pretty bad COVID related case backlogs. So, which is just, led to people spending more time in jail, exacerbating the problems of overcrowding and just making each and every case take longer to be resolved. Some of our pretrial unit is engaged in a project with APPR focused on a risk assessment tool for pretrial release. And one of the recommendations that came out of this project was to create a fast track for low-level nonviolent misdemeanor cases, the kind of cases that our familiar faces are constantly engaged with. But there has not been very much movement around that proposal. There's not very much buy-in from our DA's office. But we see that as a potentially really useful solution to some of this backlog and ensuring that our folks do not spend longer in jail than they need to for, what essentially are very, very low level crimes. Emory University operates a competency restoration program within our county jail, which is great, but there's a shortage of beds as part of that program, and the competency restoration process itself is very lengthy. So one of the things that happens with us is that a familiar face, someone with co-occurring disorders like SPMI, substance use disorders, or chronic homelessness, they get booked into jail on a very low level quality of life crime like criminal trespass or theft by shoplifting, and it's probably their fourth or fifth or sixth time being booked into jail for this same thing, and they will be found incompetent to stand trial, and they'll have to enter the competency restoration program. So this person, they're taking up a bed, they're spending all this time getting restored to competency so that they can then have be just released on time served for what was, never even a serious offense in the first place, which is just an inefficient use of resources, and does not help our individuals in any way. Another thing that happens for our folks is that we have a ton of people on probation in Fulton County in Atlanta, and they'll be placed on probation for what was, again, a low-level nonviolent misdemeanor. But these individuals do not really have the capacity to comply with the conditions imposed on them by this probation sentence. So their probation officers can't contact them. They do not have the ability to check in themselves and stay in compliance with their probation conditions. So they essentially immediately get violated on their probation, and a warrant is placed for their arrest. And eventually they come back into jail for what was probably a criminal trespassing or a disorderly conduct or a public indecency on our public transit system. So they'll have multiple arrests for this minor crime, multiple court cases, and it's a bad system. So, these are all things that we deal with once our folks cycle back into the jail. Next slide, please. And so, some solutions that we have been working through to kind of alleviate all these problems. Our biggest one and the most exciting thing for us is that a couple of weeks ago, the city of Atlanta and Fulton County voted to enter into an intergovernmental agreement for the construction and operation of a Center for Diversion and Services. This diversion center is going to be located at the old city jail. So, construction and renovation will occur to create this diversion center, where there will be co-located services, things like, a detox center. Behavioral health providers will be stationed within the center to connect with all of our clients, to write referrals when they're needed. People will be able to sleep, eat, clean themselves up. And it's just a very exciting development for us. We think that this could be, we hope that this is going to be a big solution to our problem with lead, or the fact that lead is underutilized currently. This is, perfectly constructed to be like easy law enforcement drop off, everything that we need. So we're super excited about this, and hopefully this is going to be a very effective way at keeping our folks from being arrested like they traditionally have been. I was talking about our problems with information sharing, and I want to thank our colleagues in New Mexico. They're begun engaging in this data sharing work before us, and have been a huge help to us, kind of like trying to model like what we want to do as far as data sharing. So we have drafted like a data sharing MOU and a release of information. And actually, after this meeting, we are having a data sharing meeting today. But we are engaging our technology provider, a couple of our most important like partner agencies, so Grady Hospital, Grady Health Systems, our homeless continuums of care in the city and county, and our behavioral health providers, to all come together on a regular basis, work through all of the nuts and bolts of these legal agreements, and kind of model out what a good data sharing system would look like for everybody. Our technology provider is there so they can, draw up and model out what this is all going to look like. So this is, it's a slow moving process, but we think that this is just one of the most worthwhile things that we can do, because we know that data sharing is so important as far as tracking and ensuring that everyone's cases and care is all managed and taken care of. In the meantime, before like major data sharing is occurring, we have built some data dashboards to monitor the jail population, as well as track our familiar faces when they do end up back in the jail. And this allows for, more timely case coordination, ensuring that our public defenders and social workers can connect with these clients as soon as possible. And, we've engaged with these bi-monthly screening and reentry meetings to kind of bring all of those folks together, from the public defenders and the social workers to the behavioral health providers. They all come together, and we ensure that everyone who is in the jail and who needs it, their case is staffed, and that they aren't just being, that they're engaged with as soon as possible and that they aren't just languishing in the jail. Atlanta also has a 311 community referral response line, which is exciting and allows for citizens to call for an individual who is in crisis, where they think a law enforcement response is not necessary. So that's good for us. The city has increased the funding for it, and I know personally I would like to get some data from them just to look at what's going on, the utilization, and how effective it may be. And then, we're just always engaged in systems level advocacy, whether that is getting law enforcement to buy in more on diversion, or flagging our individuals, to creating like a fast track for these low level cases, probation reform. We're always advocating for our programs and for our cohort of familiar faces. So I don't have too much more to say. Please drop any questions in the Q&A. Thank you.
Thank you so much, Nick. And now we'll turn things over to Annie in Polk County, Iowa.
It took me a second to get unmuted. I'm Annie Utz with Polk County Health Services in Polk County, Iowa. And I've been with Polk County Health Services for 20 years. And currently I'm overseeing all of the crisis services and all of our national initiatives. Polk County, if you don't know, has a population of about 500,000 people. And it's an urban suburban area. You can get kind of anywhere you need to go within 20 minutes. And so it's very easy to get around. We have a lot of, I would say, intercept zero services. So crisis observation center, crisis stabilization centers, and crisis stabilization community-based programs where crisis workers go into the home for up to 5 days. We have the co-responder model for our mobile crisis. We do CIT training with all of our law enforcement. And we have 2 psychiatric urgent cares where people can walk in and see a prescriber or a therapist at any, it's just like a walk-in clinic where you would go in and get in line to see them. We are adding a crisis advocate in our dispatch center so that when people call in and they have a mental health crisis and they don't need a co-response or a medic response, then we can move that over to the social worker who will talk with them over the phone. And if necessary, we'll dispatch out either the co-responder model or we will have a non-police based mobile crisis model that will go out. And that will be hopefully up and going within the next 3 or 4 months. Next slide, please. So what we do in Polk County is a little bit different with our Familiar Faces program than the other 2 counties that have presented already. We look at the front end before they're booked into jail rather than after they're booked into jail. So we really believe that collaboration between all of these providers on this chart or map, however you want to say it, is very important. So we meet with police, with EMS, with our pretrial release programs, 911 call center, our crisis services, our mental health providers, our substance use providers. We all come together on a quarterly basis to discuss what's going well in our community, what's not going well, how can we make changes, and then talk about what services are available just to keep it fresh on everybody's mind. Along with that, our office provides a lot of training to all of those stakeholders. So we do CIT training, community resources training, which is where we talk about all the options that are available in our community so that police and fire know of those options. Mental health first aid. We do a hearing voices simulation so that people can understand and gain empathy on what it's like to hear voices. De-escalation training, and then we just do a lot of panels where they can come and talk to people with lived experience and family members to know what went well when police were called to their house, what didn't go well, so they can just talk through on those types of things. But we really found that to make everything successful in our community, it was knowing who to call. And the only way to know who to call is if you get together and you know each other. And so that's really why we have focused so much on our collaboration. Next slide, please. Some of the barriers that we have come across is a big one is our policies. When we go out, especially our medics, when they go out and they come across an individual who really needs to receive services, is not really wanting to receive services, and they're in a dangerous situation, they'll file a dependent adult abuse report. And we have had several instances where the Department of Human Services does an unfounded, I don't know the word for it, but they don't find that there is dependent adult abuse there. And we clearly see that there is. And so it's just really frustrating when you're hoping to receive some assistance from them, and then their policies say that that is not the case. We do inundate them with dependent adult abuse reports. We continue to send them in when we see individuals over and over again. And a lot of times it does end up finally being founded and we can do something about the situation. Also, we have individuals who are unwilling to receive services and supports. So how our program works is when EMS or police are on the scene and find a situation where they believe that the person needs services and they have no idea if they have them or not already in place, they contact us. I look them up into our computer system. We have a computer system that connects all of our providers, so I can see who is working with that individual currently. If they have a current care coordinator, I will contact that care coordinator, who then is able to, with a release, contact the police and work through what the situation is. We've had instances where it just needs, the person needs a little bit more support services in place. And so by adding a few hours of supported community living during the daytime hours or during the evening hours, that has resolved the situation. We've had where there was an individual who was leaving their group home setting, and it was in the middle of winter where they were at risk of freezing to death. And by talking with the staff, we were able to put security systems in place so that he wouldn't go unnoticed when he left the group home. So it's just really trying to work with the current staff that are involved with the individual and see what we can do to make things better. If the person isn't connected to our services and they're willing, then we will have a social worker go out either by themselves or with the police or fire, depending on who has a relationship or how willing the person is, and speak with the people that they are meeting with, explain what services are available, and see if they're willing to accept those services. We have some individuals who say no and refuse to accept those services. And so that tends to be one of our barriers, is where we feel that the person really needs to have some support and they don't feel like they do. So that can get frustrating. We also seem to see that individuals with substance use disorders tend to be the ones who accept our services the least amount of time. They are not ready to change. They're not ready to make any changes in their life. And so that has become difficult in some instances. The other thing that we found is that the retention of our of the community resources with our police officers and our medics. They forget what's out there. It goes off their mind. They're busy. They're doing 1,000 other things. And so they forget sometimes what's available. So we have to do lots of training, and we have to remind them over and over again of what's there so that they can utilize those resources. And then, as I believe both of you guys said, access to services, waiting lists, approval processes, and right now really workforce shortages with our staffing. It's been very difficult to find staff, and so there's a lot of workforce shortage issues. Next slide, please. So our recommendations through our county is really to develop those relationships between your first responders, your mental health providers, and your crisis workers. Just going out and having coffee with them, stopping in at the firehouse and talking to them, going to roll call and talking to the police officers, attending trainings together, because as you spend time that's not really, it's work related, but it's not really work related, you tend to learn more about each other and get to know each other. Also, we do for our familiar faces, if the person is willing and would like to, we will hold staffings with having police and the EMS medics at the staffing to make sure that the individual knows we're all on a team together and we are here to work together with them. So having everybody involved in that. We have had where we have contacted the police to come out prior to any incidents because we know that something may occur or happen. And so we want that local patrol officer to know the individual so that if they do get called out to that house, they know what they're walking up to and they know the situation of what is happening. We also want to make sure that we keep all of our, keep everybody up to date on what is happening and all the new services that are being created. And we do that partly through our quarterly provider meeting, but also through emails to our EMS and fire departments so that they can pass on that information. And then we added a 24-hour 365 resource and referral line where anyone can call this phone number and receive information about mental health services and get connected up with those services. It's also a way for them to access our crisis stabilization services. And so we have made cards and we've given those out to all the fire departments and police departments so that they can handle those out to individuals when they come across individuals who don't need to be arrested, but just need to have some support and direction. And then the last thing is just to create a continuum of services for all the support needs. So really figure out what your gaps are and make sure that there are supports available. What we found is that if you have individuals connected to long-term services and supports, then they're less likely to use crisis services. So the more long-term services and supports that are available in the community and people are connected to them, the less that these crisis services and the familiar faces will be needed. So that is all that I have.
Great, thank you, Annie. And now we have some time for questions and answers, and I'll turn this over to Rita.
Okay, so first of all, I think if you've been keeping up with the chat box, just a reminder, we're on WebEx, so people can't just chime in. You need to put your questions in the chat box and we will facilitate those as best we can. But I'm just gonna try to kick some of the conversation off. I just was making notes of, some common themes as there are 3 sites we're presenting, and maybe that will bring some questions from our participants, and if not, just to have a little 3-way conversation here with our 3 counties. So I just really, I think, wanted to pick up really, Annie, where you left off on some key things that maybe was at least, sounding a bell with me in terms of the familiar faces population is one that's going to most likely cycle in and out of crisis. And as we were talking about the work in this particular webinar, we spent, some time, as Annie just said, that the real key is to get these individuals involved in some long-term services as a way of, a preemptive approach, if you will, to that next crisis event, and being able to recognize if the individual, has some sort of a trigger incident going on, they've lost a job, they've lost their housing, they are in probation violation status, any one of those things. So I just wanted to see if Annie, Pam, Nick, if any one of you all would want to just maybe respond to those preemptive approaches that you have either discussed or implemented.
I can go first. So We have a very extensive long-term services and supports service options. So individuals, we have assertive community treatment teams that people can become involved in if they meet those criteria, or a forensic assertive community treatment team that works with individuals who have been in jail multiple times. And then we also have a lot of habilitation funded services through Medicaid, where they can receive hourly, I call it supported community living. That was the old term back in the day. Now it's just called habilitation, but they can receive hourly services, or they can receive up to 24-hour services within their home. And so a lot of individuals receive a little bit of service. Some individuals, we have homes that they live in, and Polk County owns 75 houses that we rent out to our provider agencies so that they can then sublease them along with our provider agencies owning their own homes also. So affordable housing is very difficult to come by. And by owning the houses, we were able to keep those rents low so that people can afford them and can live in them. So having housing and then having those support services along with them. We also believe that people who can work should work. And so employment is a big push in our community to make sure that people are working, because as people work and are involved in either work or the educational system, then they tend to stay out of jail, they stay out of the hospital. We track outcomes on everybody, so we know that as people get more involved in work and education and have a home, that their jail days, hospital days, ER visits, all that, homeless nights decrease over time as they're connected to services.
Thanks, Annie. And you, Pam or Nick, anyone want to jump in on that one?
Sure. So for Bernalillo County, there's a few things that we are testing right now. One of them is we're working with our local metropolitan court, our mental health court, and our competency court to provide strategic releases during daytime hours. They've recently hired a forensics navigator who will follow these clients while they're in custody or while they're out and provide long-term care. We feel that that's like going to be one of the solutions. I think what we found is that if we can, and a lot like what Andy was mentioning, if we can connect clients to long-term care and have somebody who can pretty much handhold and get them connected to services so they don't feel alone and track them within the community, the outcomes are a lot better. We're also working with our local DA's office as well to partner with them, because they want to do a lot of diversion efforts as well for offenders who have low-level crimes that they can possibly dismiss as long as they get connected to long-term services. So we're in the early stages of that collaboration, but so far we've had some successful outcomes. One case was dismissed as long as we connected the person to a treatment center and a long-term case manager. We also have our law enforcement assisted diversion program, which also is taking community referrals so that we can refer for long-term case management to them as well. So,
thank you. Nick, I don't know if you have anything to add, otherwise I'll move to another.
I don't have anything really substantive to add. I mean, long-term services is where we really lack and is really a focus for us. Another big focus is just housing stock. We do not have housing for people. Recently, our accountability court was awarded a grant related to housing. So that is, a step in the right direction. But we are really trying to position ourselves to advocate for more services through, the data that we can produce on all of our high need individuals.
Okay, thank you. And I'm going to just jump to some of the questions that now have come through on the chat. So Pam, I think this one goes back to you as far as how did you get the buy-in and support on, I'll call it the scheduled release times, so that it's not at 10 o'clock on Friday night or, whenever there's just not going to be great access to services.
correct. Thank you. Thank you for the question. So I think a lot of it generated from our Criminal Justice Coordinating Council, our working group for the high frequent utilizers. We invited judges to attend. One of those attendees was our local judge, Judge Dominguez, who's very passionate about alternatives to incarceration. And she, so when clients are facing competency, we all know that they're long jail terms, you know, while they're pending the competency, and she wants to shorten those terms. So really, I think the buy-in came a lot from her office, because she has the ability to list when they're going to, or determine when they're going to be released. And so we had conversations, a lot of meetings between Bernalillo County Behavioral Health, the Metropolitan Court, her court, and as well as the jail, so that we can plan strategic releases during daytime hours. So really it's on their conditions of release that she'll place them, you know, not to be released, you know, before say 7 a.m. so that at least they're being released during daytime hours. And then the local jail will communicate with their releasing department to make sure that these clients are getting released, you know, say even before noon. We also get a list of those clients the reentry center, and we can get them connected to services. But a lot is happening behind the scenes, but the buy-in really came, I think, from taking the judge's lead.
Thank you. And, you know, I mean, those, you know, champions like judges and prosecutors, you know, are obviously so crucial to so much of this, you know, coming together. And I guess I'm just going to go down in the weeds just a second more on that one, because I just know from my own personal experience that when the jail gets a release order, they feel like they have to immediately process it, you know, in terms of you don't want to get into any sorts of, you know, unlawful holds. And so I guess, you know, like if you have any examples of how maybe you change the wording or on, you know, those orders of release and so forth, we'll kind of follow up with you on that, because I have a feeling that might be the next questions coming our way. So, and speaking of next questions coming our way, you know, I feel like it's just ongoing as far as how much sites struggle with sharing information. And I know that there's a lot of curiosity about your universal release of information. And you know, if any of you want to maybe just spend a little bit of time describing, you know, what works for you, and, you know, the advice you have on increasing sharing of information and getting out of silos, and, you know, just your general advice. So I don't know who wants to jump in on that one, but I think you all three have done some great work in that area.
Lisa, if you don't mind, I'll take the lead.
Sure, thanks, Pam.
Okay, so again, ours was some planning that we did with the universal release of information several years ago, but it's been a work in progress. I mean, up until this year, here we are 2021, and we're still, we still had to undergo some revisions. What we discovered when we had our initial draft was some of the things that we didn't anticipate is the primary holder of the document, which is Bernalillo County, wasn't listed. It was given as a choice of whether the person, so we allow the client to sign an initial over each of these agencies. And we were given as an option, and a lot of clients weren't signing that under Bernalillo County. So that basically meant that the entire release of information was void because we're the holder of the document. So I think if there's anything that's important to document about one of those struggles is to make sure that your agency, the document holder, is listed as you know, that they're the document holder and they're listed as an automatic authorized entity. And then our release, our memorandum of understanding that we have with these groups, I think getting together with everyone. So I know one of the questions is particularly law enforcement. Law enforcement has been really open with us because their information is public record. Where we run into some struggles is with the hospitals. And we've had to go back and forth with several of these agencies that don't honor the release of information because they're uncertain, because it is broad. It includes multiple agencies. And so they'll require the individual to sign their particular release of information. So we struggle with the two of those.
Thanks, Pam. Nick or Annie, you want to jump in on release of information?
I can jump in. So part of what's good about who provides our crisis services, it's our county hospital. So they can look at their own records and can see what they need to see. And the majority of our individuals utilize services at our county hospital. So that part is good. And then, like you said, law enforcement information is public, so is our jail information, so they can notify us whenever they need to. But we also have a jail diversion program that is run by one of our mental health agencies that's right there inside the jail. And we, our office pays for the mental health services in the jail. So we have access to all their information because we're the funder for them. But it really counts, it relies on the individual getting the individual care coordinator getting the release of information so that they can then feed back the information to the police or to whoever they're working with, because without that, they just get involved and stay involved. And so that's really how we rely at this point in time, is on making sure that they have their individual release. One of the things that care coordinators try to do when they first do an intake and then yearly thereafter is to have the individual sign a release to our jail and sign a release to their local police department, so that if it should be that they get involved, that they can automatically talk to them and they have that release already available.
Thanks, Annie. Nick, anything from Fulton County on sharing information?
Yeah, I mean, just kind of echoing what Pam and Annie were saying, like our law enforcement and jail information is public, so we can distribute that to all of our behavioral health partners and services. We are still working through the release of information stuff, so we are not engaged in any kind of sharing of health data or anything protected. But all of our partners, I would say, are very receptive to the idea. They just want to feel very protected before they start doing it, which is a very reasonable thing. And so that is what a lot of our data sharing work is focused on, is developing those legal agreements. But we have had good success as far as just coordinating around cases and making sure that providers are connected to our individuals, because we can, within an hour of a person being booked into the jail, we can know and we can distribute that information.
So Nick, I'm going to put you on the spot here, and I could be wrong, but I think just following up on that care coordination and collaborative case management approach, which is different from aggregating data and just being able to give numbers and the information like that, where you're not so worried about protected information. But am I right that you are going to start communicating across with each other using Slack? And for those who are not aware of Slack, but some type of instant messaging service?
Yeah, we have a contract with Slack for their HIPAA compliant messaging service. We aren't using it to transmit HIPAA protected data because we don't have the approval to do so yet. But once the ROI and necessary legal agreements are in place, that is the intended use.
So it would be very time sensitive in terms of if a person is, just reported they lost their job, or they can't, no money for their meds, or whatever is their crisis at the moment, is where you're heading with, kind of having this core group working with the individual and communicating.
Yes.
Thanks. Hold on here. I know we have another question around this, getting information for continuity of care in the jail, and just getting providers to share. So I'm not sure from how this was put in the chat, but if it's primarily inside the jail, we're having a hard time getting providers to communicate. I don't know if any of you are addressing that.
Lisa, so this is Pam from Bernalillo County, and so I think we struggled with a little bit of the same, not necessarily with sharing with the jail, because the jail has had a lot of buy-in because they see the benefits of sharing information. Where we struggle is when this information is not shared equally between the the DA's office and the public defender's office, there has been some concern raised by the public defender's office on, well, will this information make it to the jail? So if we are discussing someone's substance abuse amongst the group, will this information make it to the courts, and will it be, factored into the decisions? And so one of the things that we had to do with our release of information was we had to remove the courts from that document and add in case managers, because then the information becomes more of a HIPAA protected versus public information. So that was one of the key things that we learned this year, was we had to remove that, including we had to remove our probation and parole and our pretrial diversion entities, because they also have the ability to make recommendations to the court.
Thanks, Pam. I think I remember you guys bringing that up on a call. And so, I'm hoping still something that can be worked through, and knowing that how important it is for the voices of probation and supervision, to be involved. Again, that work is going to involve supportive prosecutors and judges to understand, the complexity of these cases and the number and the amount of effort to work with the individuals without it, resulting in a probation violation report or taking them back to court and so forth. So I'm sure just stuff that, all sites across the country, have to tread through all these waters. I'm not sure we have, I don't think we have, I think we've covered everything in the chat box. So, I think maybe just for kind of a closing round of a question, I'm going to pick up on, I wrote this down. I thought it was really great when you said, moving from difficult to engage to essential to engage. And I think that that's just really, a great frame on this particular population of our familiar faces, and knowing that even though you all have spoke today about, difficulty and access to services and, never enough staff and the shortages and so forth you're dealing with. But, at the end of the day, and the bottom line is you can have those services in place, and you just cannot get the person to engage. And, which is just telling you that you're probably going to see them back, right? You're going to see them cycle through again. So any kind of closing thoughts you have around your next steps on addressing and ensuring that, you move towards that essential to engage in kind of what your, what your next steps might be to see that through. And I probably put you on the spot. Does anyone want to go first?
For us, I think what we're trying to do is just to keep people out of the jail or out of the hospital if that's not where they need to be. And so we have an individual who is connected to services, but still goes to a Quick Trip, local convenience store every day, and they call the police every day. And he was being taken back and forth to the jail every day. Even though he was connected to services. What we've put in place is the police officer has learned that he is connected to one of our service providers. And now when police get called, they call the Forensic Assertive Community Treatment Team, which he is part of. And the team just goes and picks him up and takes him to their office and talks with him. So instead of having him have to go somewhere and get charges and go through that whole process again, the police are just calling, or they'll even give him a ride over to their office, just to divert him from those. So it's really trying to, it's not reducing their calls for service, but it is reducing our court system by having him not have to go out to jail and get booked in and go through that whole process every single time. So it's individual, and especially for some of those that are very, very difficult, you have to be creative and think of different ways of doing it. And sometimes it's going to cost a lot of money, but when you think about for community long-term services, but if you think about what it's costing to have the jail and the courts and that sort of thing, and then the person's quality of life, it's worth it. So.
Thanks, Annie. Pam or Nick, you have any next step strategies?
Sure. Something that we started doing through the high frequent utilizer group, and we specifically have labeled, well, I don't want to say label because that's what we're trying to avoid with the essential to engage. We will get together a multidisciplinary team, and we have weekly roundings where we will discuss, currently where the client is. So if they are in jail, we have the jail's medical contractor join the call, and they'll let us know their status, like today's a good day, or hey, they're getting ready to get released and they're not talking to anyone today, or they've latched onto a certain provider today and they're doing well, and so we're able to work with them. So we at least get an idea of what their state of mind is and how to approach them. I think that's one of the steps that we're doing. And then again, the county is working with the city and the local University of New Mexico hospital to develop also a FACT team. And so being able to provide that ongoing care, a lot like what Annie and Nick have described as well, having that connection, I think is next steps for us. And then being honest and sharing that information with law enforcement. I think that, we're very fortunate here in Bernalillo County. Our crisis intervention units or our mobile crisis teams have clinicians and have people that understand the overall picture of, we're not here to harm them. We're here to provide solutions and take off some of the burden on some of these criminal justice and hospital and, all these other services that we provide here in the community. So understanding that if we can reduce the cost and provide better outcomes, it really saves in the long run, not only for all of the partners involved, but for the individual themselves.
Thanks, Pam. And Nick, I'm going to just guess that your next step is you're super excited about your new diversion center coming online, but just anything you might want to add to that conversation.
Yeah, obviously the diversion center is huge for us, and it's been something that we've been, fighting for and advocating for years. So to have that approved and underway is just, I can't even describe how excited we are. As far as like long-term next steps, we are pretty encouraged by our bi-monthly case staffing meetings and the work that's going on there. I think it's really knocking down some walls between our agencies and encouraging everyone to coordinate their efforts better around our folks. What we really need to focus on outside of the diversion center is like getting more services and sharing information more. Like that is just really our struggle here. And it's where now that we know that we're getting a diversion center, I think we're just going to put all of our efforts into those areas, really.
All right, thank you. And before I turn it back to Mark for some just closing information, I just want to thank our 3 sites today. I want to especially thank everybody who tuned in today, because I'm guessing the reason you are here today is because you are somebody who's dealing with this population of familiar faces, and just a thank you to you for this hard work and everything you're doing in our communities. So with that, I'm going to turn it back to Mark.
Thanks, Teresa. And then just echoing my thanks to the presenters for your presentations and for the discussion today. And wanted to let folks know to stay tuned for an announcement about the follow-up office hours session in January of next year. And that'll be a chance to ask questions of the panelists and share what's happening in your own communities. And then in the spring of 2022, we'll have the 3rd and final webinar in this series, and that'll focus on building out and sustaining those community-based supports to better serve this population. And then here's our panelist contact info, and just wanted to extend a very big thank you to our presenters today for giving us great information and perspective. And thank you to all of you listening in on the webinar today. We'll have this webinar recorded and posted in about 2 weeks. And thanks so much again to everyone for joining, and have a great afternoon.